Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on another segment of Health Professional Radio. Biomarker testing is an important tool that doctors can use to find the right treatment for certain types of cancer, like acute myeloid leukemia or AML. It's a difficult to treat cancer of the blood and bone marrow. Well, because many patients have never heard of these advancements in testing and the emergence of targeted therapies, it's very important to advocate for yourself and to ask the right questions to find out what biomarker tests are available to you at diagnosis. Well, here to explain more about AML and the importance of biomarker testing this Blood Cancer Awareness Month are Dr. Eytan Stein, a hematologic oncologist, and Shirley, who's living with a particular type of AML. Welcome to Health Professional Radio, both Dr. Stein and Shirley. Thank you both for joining us.
Thank you.
Thanks so much.
Well, Dr. Stein, tell a bit about yourself, if you would, briefly.
Sure. So I'm a hematologic oncologist, and I specialize in the treatment of patients with leukemias, and I have a specific focus and interest in the treatment of patients with acute myeloid leukemia, which is really the most common type of acute leukemia that's diagnosed in adults. It's estimated there'll be about 21,000 new diagnoses of acute myeloid leukemia in the United States this year.
And Shirley, a bit about yourself, if you would.
Well, for the last 10 years, I've been living with MDS first, myelodysplasia syndrome, and then it progressed to AML, acute myeloid leukemia. I am doing well now, and I really attribute my health to the biomarker tests that I was told about 5 years ago in this 10-year journey.
Doctor, you mentioned briefly some of the aspects of AML. Delve a bit deeper into it. Tell us what it is, what causes it, and some of the mutations that occur.
Yeah, so it's a really good question. AML is a disease, as we talked about, which is caused by mutations in a kind of white blood cell called a myeloblast that leads to uncontrolled white blood cell growth. And that uncontrolled white blood cell growth is really the manifestation of having the disease acute myeloid leukemia. It's primarily a disease of older adults. The median age of diagnosis is 68 years old. And when you have acute myeloid leukemia, you have these mutations. If a specific mutation can be identified by a biomarker test, perhaps, and what we've discovered over the course of the past 5 to 10 years, is that in fact, there may be targeted treatments that can go after that particular mutation and lead to improved treatment outcomes for patients.
Shirley, tell us a bit about your particular diagnosis. What led up to it, and were there any challenges in being properly diagnosed?
Well, at the time, I was a retired university professor, and so I took on that diagnosis as a major research project, one that was extremely personal to me. And I realized very quickly that I was going to have to be my own advocate, that no one else was going to do this job for me. But at the time, my spouse and I were playing a lot of music. We were traveling to summer festivals and appearing on stage. And I kept my blood values and my blood draws going the whole time and watched them sinking lower and lower. And at my lowest point, an oncologist said to me, "Shirley, you have 4 to 6 months to live."
Wow.
And that spurred us to get some second, third, and fourth opinions. One of the oncologists that we consulted with said, "Shirley, you need a biomarker test because it's quite possible you have a mutation." And so that was my next step.
Doctor, what were the next steps that needed to be taken after Shirley's initial diagnosis?
Yeah, so, like Shirley said and like Shirley's doctor said, having that biomarker test, I think, was really critical in developing a good treatment option for her and for other patients that have this biomarker testing done. Because when you do the biomarker testing, you can find mutations. Like in AML, there's a mutation in a gene called IDH1, which occurs in about 10% of patients. And what that does is it helps your healthcare team develop a treatment plan that is specifically for you. And this biomarker testing really has paved the way for many, many targeted therapies, not only in acute myeloid leukemia, but really in all cancers that oncologists treat.
Shirley, how invasive was the testing? What did it consist of?
Actually, the testing was as simple as a bone marrow biopsy, a blood test, with the results sent away to have sometimes a week or so with the return results. But I just remembered that when I went to a routine oncology appointment, my oncologist handed me the paper and said, "Shirley, something new has come up. Here are your results. You have a mutation. It's IDH1. And I said, "What is that? What does that mean?" And he said, "It means that your disease is progressing." I was shocked, but I didn't realize at the time that that was a good thing. It was a major turning point in my 10 years. This was like halfway through. And so it did really help my oncology team to design a target for a treatment plan to specifically treat my disease. And I always say I was at the right place at the right time with the right mutation.
Dr. Shirley being at the right place in the right time with the right mutation, that's not going to happen across the board. I mean, is this a rarity? What questions should people be asking to put themselves in as positive a position deliberately as Shirley found herself in almost by accident?
Yeah, so, it's really important for patients to advocate for themselves with their oncologist. The patient who has the diagnosis, and it's an ongoing collaboration between the oncologist and the patient, but the patient needs to speak up themselves, needs to have family members or friends that are speaking up for them to advocate to have this biomarker testing. And what you want to do is you want to ask the oncologist, are you going to be doing biomarker testing for mutations? When are you going to be doing that test? When will I receive the results? And perhaps most importantly, how are those results going to affect the treatment options that you recommend for me and the treatment of my cancer? You can learn a little bit more about this by going to the website servier.us/biomarker testing, servier.us/biomarker testing, where there's more information about this.
Is there anything that either of you'd like to add?
I would just like to say I'm so very grateful to brilliant scientists and researchers that discovered how to test for these important diseases that we carry.
Well, I appreciate both of you joining us here on Health Professional Radio this morning. Appreciate your time. Thank you so much.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Eytan Stein and Shirley. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.